Hello, my name is Corliss Ivy. I'm a licensed clinical professional counselor at Cancer Treatment Centers of America. And today I'm excited to discuss taking care of ourselves in the workplace. One of the most exciting topics that we talk about daily is, what is stress? Long gone are the days where we believed that stress was just something that we thought or felt in our own mind. We're beginning to understand that stress is truly a massive systemic biochemical response in the body. We once believed, and it remains true, that this response elicits a reflexive chemical shift upwards of 1,400 hormonal changes in the body to maximize our chance of survival. And that's certainly true. We also now know that a stress response can be produced with experiences that we might describe as positive, like preparing for a race, a test, or a graduation. We also know that our bodies respond to toxins in the environment, from the food we eat, especially those with the use of pesticides or preservatives, some of the skin products that we may use, water, and even the air that we breathe. I think we've all been behind that vehicle that has exhaust that's floating right into our cars. The autonomic nervous system is where we learn about the sympathetic and the parasympathetic systems in our body. We know a lot about fight, flight, or freeze. In a stress response, our body produces several changes all at one time. A few include our pupils dilating, saliva flow decreases, our muscles become tense. Many of us have shoulders that rise up around our ears or hunch in. Our blood pressure increases as major blood vessels dilate. Output of digestive enzymes in our stomach decreases, and food movement in our bowels slow down. From a physical standpoint, patients may report having a headache, muscle tension or pain, chest pain, low energy, unexplained soreness in the mouth, or irritable bowel syndrome. For a patient that's undergone cancer treatment, we may also hear about side effects from treatment, including fatigue, pain, or nausea. Additional behavioral changes could include an increase or decrease in appetite, weight gain or loss, difficulty with sleep, specifically challenges getting to sleep or staying asleep for the recommended 7 to 8 hours a night. We also see changes in sexual functioning for both men and women, challenges in relationships, self-medicating, social withdrawal, and restlessness. From a cognitive standpoint, patients will often discuss difficulty concentrating, confusion, memory loss. If you're working in a setting with someone who's gone through the cancer process, gone through having cancer, they may discuss having lack of motivation or feeling overwhelmed. Some of the emotions that are associated with stress is fear, worry, irritability, guilt, anger, intense sadness, hopelessness, and especially one that you may see in a work setting, performance anxiety. We want to remind ourselves that any stream of income may impact the financial health of certainly a patient, but also their family. It could also have a direct impact on their ability to continue treatment. Some stressors that may present specifically in a workplace could include losses in a workplace, inadequate resources, limited or no control over workload, lack of recognition for achievements or hard work, unclear or overly demanding job expectations, working in a chaotic or high-pressure environment, and certainly workplace and carry-over stress. As much as we want to understand that work and home are separate, we don't always leave our concerns and stressors at the door. Signs of burnout could include poor job satisfaction, work impairment, a sense of ineffectiveness, apathy or disinterest, increased tension in relationships with coworkers, exhaustion, or increased absences. We want to take a moment to distinguish between acute versus chronic stress. We are all hardwired to to support and manage brief or transitory stress. We refer to this as acute. Chronic stress, on the other hand, occurs when the body stays in a stress response to the extent that the autonomic nervous system is not able to activate the relaxation response regularly that we need, that parasympathetic system that we discussed earlier. Signs of chronic stress could include cardiovascular disease, including high blood pressure, abnormal heart rhythms, heart attack, and stroke, obesity and other eating disorders, reproductive and sexual health concerns such as pain or loss of sexual desire in both men and women, skin and hair problems. We tend to see an increase in acne, eczema, and hair loss, and especially gastrointestinal problems, including irritable bowel syndrome, GERD, and gastritis. This is amongst a host of other concerns. But rest assured, there is hope. There are many ways to take care of yourself. One of the best ways one can take care of themselves is to seek out a supportive care relationship. It could be with a therapist. And what can you expect by going to a therapist? Dr. Nora Ishibashi reminds us that we hold the belief that we each can find satisfaction by taking the time to understand what is most deeply meaningful to us and making our lives a harmonious expression of that meaning. The focus of this unique and powerful relationship is on working together to understand how you want your life constructed, what obstacles prevent you from pursuing or achieving your ideals, and what needs to happen so that you can see your life well lived. In addition, there are several mind-body practices that run interference with the stress response and helps engage the parasympathetic system. We can take comfort in supportive relationships that could be family, friends, co-workers, members from our faith or spiritual community. The question that we want to ask ourselves is, who are the people that we can rely on for support? There's been a lot of research dedicated to understanding the power of meditation, prayer, deep breathing, and especially guided imagery. And the fun part about guided imagery is that we combine deep breathing and holding an intention or image in our mind to help us relax, and especially to train the brain toward relaxation when we need it most. Another fun modality is laughter. Also, movement-based modalities. This could include yoga, qigong, tai chi, fitness, or dance. And we now know that based on our bio-individuality, there are styles of movement that are more or less or most ideal for each of us. There's a growing body of data that talks about biofeedback, tools and resources that support our ability to measure relaxation. And one of the fun ones that we have here is massage. When I talked earlier about muscle tension, there are times when just releasing the tension could be such a nice stress reliever for the body. Additionally, there are ways to recover or prevent burnout. This would include proactively addressing concerns, and that could be interrelational with other coworkers. It could also be with the workload specifically. We want employees to feel empowered to share their concerns and to have those concerns addressed. Clarify job description, learning more about what's expected from your specific role, partnering with leadership to prioritize tasks, requesting different duties, especially when health dictates a change in performance, highlighting and documenting your skills and strengths, establishing boundaries, certainly in relationships in the work setting, but also around time. Dedicating time of when to start and finish tasks could decrease stress within the workplace. Using vacation time or benefit time is a healthy way to also take care of yourself. Another important tool is adopting daily habits that support your mind-body wellness. This could include starting each day with an intention, meditation, or prayer. It could include use of foods that are nurturing to the body, as well as use of sleep hygiene. And a forgotten tool that we want to mention is nourishing our creative energy. There's a lot of research right now that discusses the use of our creative strengths, skills, and using those things that we're most passionate about to help us de-stress, produce relaxation, and to have fun. One of the best things that we can do for ourselves is creating successful self-care. Some of the questions we want to ask ourselves would surround: how are we doing in each area of our life? Acknowledge our strengths and our challenges, as well as our readiness for change. Finding resources and support, and then ask ourselves, how am I taking care of myself? And how would I want to take care of myself? One of the most important things we can do for ourselves is making self-care a priority. And it's the ability to direct and manage our health and our well-being in all aspects of our life. Thank you for joining me on this fun discussion about stress and ways to increase your self-care. For more information, please visit cancercenter.com.